our view is that it's probably reaching the peak overall, and that's what the flattening shows. I think it's important, and I'm saying this because new data will come out presumably tomorrow. My expectation would be that the number of deaths may well go up, because there has been after every weekend, we see a dip over the weekend and for the 2 days afterwards, and then an increase as we catch up with the numbers. And after a long four-day weekend, there may well be a bounce up tomorrow. So I think it's very important we don't get to the point where we say, look at the numbers of deaths, that means we've passed the peak. But we do all think that this is flattened out. Sadly, we do think that high numbers of deaths will continue for certainly a short while on from where we are at the moment. I think there's an additional reason that we are so I think at the moment we are not yet at the point where we can say confidently and safely this is now past the peak and we can start thinking very much about the next phases. I think the additional
we will do whatever it takes. This is our plan.
But really and the time goes from 21st of March to the 15th of April. And what I see that encourages me when I look at that slide is 2 weeks now of definitely not increasing anymore. I see a flattened curve. And for me, that is evidence that what everybody has done together has worked for us all.
More people can be tested. And in fact, we have, as on the point about the peak, because you're right that the clear message is that it is too early to make changes, and therefore the message to the public watching is that everybody can play their part by staying at home, which protects the NHS and saves lives. And that message is very clear and very straightforward. Of course, I understand there's a broad discussion about what next, but we're very, very clear about the thing that people need to do now. Approximately three. At the core of our plan is to protect the NHS from being overwhelmed, so its ability to care for everybody who needs that care is always there and is never outmatched by the ability of the virus to do us harm. That is central to our plan, and I'm glad to say that the spare capacity in critical care in the NHS today has reached a new record high of 2,657 beds. Expanding the NHS faster than the growth in demand has been a critical objective throughout this crisis, and it means that every single person who's accessed NHS care has been able to get the very best available.